everybody, and welcome to Screen, Intervene, and Everything in Between. I am Jill Gunther. I'm one of the social emotional behavioral learning specialists with Nebraska NeMTSS, and I serve regions 3 and 4, which are ESUs 1, 7, 8, and then 9, 10, 11, and 17. And I will let Mackenzie introduce herself.
Hey everybody, I'm Mackenzie Rydell, and I am also a social emotional behavior learning specialist. I serve regions 1 and 2, which is ESUs 2, 3, 4, 5, and 6, along with LPS and OPS.
Hello, I'm Emily Arkfeld. I am the third SEBL specialist, and I serve region 5, which is ESUs 13, 15, and 16.
Perfect, thank you. All right, so today our learning objectives, we have divided it up into 3 different parts. And so feel free as you're watching today, you can certainly pause after each part and have some reflection, have some discussion if you're watching with your team. But our part 1 is reviewing the purpose of a screener, and then talking about creating a team and reviewing that existing data, and then selecting a screener. Our part 2 really focuses on determining those implementation logistics, as well as establishing that timeline and follow-up protocol, and then engaging stakeholders. And then part 3 has a focus on administering the screener, analyzing and acting on the data, and then self-reflecting on the process. As you can see here on this slide, for your convenience, we do have a QR code for our PDF of the slide deck so that you can follow along as we go. All right, so this is a great representation. So this link really represents how social, emotional, and behavioral competence directly impacts that academic skill growth, which ultimately leads to that academic achievement. Students who display more competence in those social, emotional, behavioral learning skills really display that higher academic growth. And if we intervene with those missing skills, we're ultimately intervening with the academic outcomes too. So again, this visual of a link really shows that representation nicely. Why screening? So screening really helps to support and can be integrated within an MTSS. Screening can help to inform prevention and those early intervention strategies and identify students at risk. It can also help to identify concerns at various levels, whether those levels are at the grade level, within the classroom, the educator, the school, so many different levels that it may help to identify those concerns at as well. Can also help to improve that access to mental health supports. And then also just some statistics to think about as well that are noteworthy here are 13 to 20% of children meet the criteria for a mental health disorder. But only 12% of those students with mental health disorders receive services. And then those youth who are receiving the services are 6 times more likely to complete treatment if they're accessing them within the school. So this visual also is a nice representation of how we have divided out our training today within those parts. So throughout our time focusing on screening, intervening, and everything in between, you'll see this visual to help identify how we've broken it up into those segments. So first we'll be discussing the purpose of a screener, then moving into talking about creating a team and reviewing the existing data, and then selecting a screener. So what is the definition of a universal screener? As you can see here, it is the process of routinely examining all students' social, emotional, and behavioral health. Universal screeners really help to inform the core. So tier 1 core instruction is what we do for all students. We can use that data from the universal screener to help inform the actions of tier 1 and doing it from that prevention lens. So screeners can still be used to help in identifying those tier 2 and tier 3 support needs, what we're doing in addition to tier 1, not instead of, but really thinking about how beneficial it would be to use data that we have for the whole school to inform those practices for all students. So screening really helps provide more of that structured way to find out and consider the needs of all students. So the purpose of a screener really is to generate that new and that useful information on the social, emotional, behavioral health of all students. Early identification is key. And we have to remember that screening is not diagnostic. It's simply to help flag or suggest those further follow-up or additional support. The purpose of the screener is to identify those unmet needs early on, and also when the available data that we have doesn't do that. And so again, really thinking about the purpose of the screener, it's to help prevent and also mitigate those mental health challenges. It's to promote resiliency. It's to identify both those external as well as internal behaviors. It's to help identify resilience factors and well-being, serve students in interventions, as well as support stakeholders in that understanding of developmentally appropriate behaviors. Here we have a nice layout of some suggested steps to ensure screening success. And we'll talk a little bit more about each of these steps throughout our time together, but just to go through what those steps are. So the first step is building that team and working to identify the objectives. Step 2 is reviewing those existing data sources, so what we might already have available. Step 3 is those screening considerations and the types of measures. Step 4 is determining those implementation logistics. Step 5, we're moving into establishing the implementation timeline, as well as that follow-up protocol and what that looks like. Step 6 is engaging school stakeholders. 7 is creating that family engagement plan and really thinking about what engagement means. Step 8 is administering the screener. Step 9, referring students and implementing those interventions. And then step 10, that team self-reflection. So our first step is building that team. So this is a nice visual that really demonstrates the relationship between student support teams, collaborative problem-solving teams. So those could be the grade level teams or PLCs. Building leadership teams, which could be elementary and secondary, and then district leadership teams. And the most important part is to really think about who is sitting in the chairs on each of those teams, because we really have to remember the importance of that communication, that collaboration, and those partnerships when we're thinking about the structure of our team. So I want you guys to just take a minute just to kind of reflect and consider whether or not you have a systematic structure that's similar to this. Do you need to maybe establish some infrastructure components to allow for this type of teaming to happen? And it's important to also remember that ideally your screening team would be composed within your NeMTSS team. So this team could include staff who are knowledgeable around that social, emotional, and behavioral health, mental health, and also staff who understand that implementation within a general education classroom, and then also administration. Other stakeholders that you also have to have those conversations, that communication, that collaboration with would be the parents, the community partners, and students where appropriate. Moving into identifying your objectives. So this is also really part of that step 1, in addition to gathering that team. So your team must work to identify objectives together. These are just some different examples of objectives that your team might have discussions around. So providing a survey snapshot of student mental well-being to inform planning, to identify individual students who might benefit from early support, or to consider the impact of early support and targeted interventions, but really ultimately thinking about what is your why. The second step to ensure that screening success is to really review existing data sources. Thinking about what types of data would be helpful to know, really thinking about pieces of data that will help inform your areas of concern, your unmet needs, things like that. So after identifying what data you might need or what you might want, and then what you already have available to show those needs and identifying, then you're going to need to have those conversations around what screener might help fill those gaps. So this chart here comes from, we have a link there at the bottom, which is a great resource to take a look at, Advancing Comprehensive School Mental Health Systems, but it's a great resource to access. So this chart just does a nice job of providing some different examples of data indicators that reflect those school mental health outcomes. A critical component of school mental health systems is that use of comprehensive data for data-driven decision-making to help inform those school mental health planning, as well as that delivery of services. So just some things to think about. So within system functioning, school climate, trauma responsive policies and practices, school staff retention, school staff well-being, information on discipline practices, and family engagement. Looking from student academic functioning, so things like grades, benchmark assessments, state testing, attendance data, expulsion and suspension, school connectedness, and engagement with learning. And then from student psychosocial functioning, social and emotional wellness, mental illness, interpersonal relationships, food and housing security, and risk behaviors. So like I said, this chart just does a nice job of really taking a look at some of those areas. Some screening considerations, so things to think about, things to have those discussions around with your team. How much time will it take to complete the screening? How much does it cost? Who will analyze the data? What do we want to measure? And then is the measure reliable? Is it valid? Other things to think about, just identifying what grade levels to begin, also thinking about the time of year to give the screener, and then also identifying whether or not you're going to do it 2 times, 3 times. So all of those just considerations to have those conversations around. This is just some good reminders around those key screening elements. So making sure that the screener is appropriate, so it's fitting that need, and it's really fitting the context, that it's also technically adequate. So thinking about that validity and reliability. That it's useful. So it's supplementing existing data and generating new and usable information. That it's also feasible, so it's easily implemented, and there's that pathway for referrals, so that is clearly defined. And then that it's beneficial, so does no harm, that it's equitable, and then also culturally responsive. Another important component of that step 3, when we're thinking about ensuring that screening success, are looking at the different types of measures. So it's important that your team is really carefully considering what information that you're looking to gain. So what are you seeking to inform, and how are you going to inform interventions, and what social emotional behavioral outcomes you're striving to impact? So here we have a few different types of measures with that nice explanation. So from a deficit model, identifying where concerns or risk factors may be evident, including those internalizing as well as externalizing behaviors. A strengths-based assessment is going to assess protective factors, student assets, competencies, strengths. And then the multiple measures approach would consider both areas of social, emotional, behavioral strengths, as well as those areas of concern. So together, these measures not only identify deficits in a student's social, emotional, behavioral functioning, but it also highlights those strengths that could be used to help overcome concerns. Here we have a few different examples. There are lots of different screeners out there. Some are free, some cost money, some would be teacher report, some are parent report, some student report, and some analyze the data for you and some don't. So lots and lots of different options. The link at the bottom of the slide there, the screeners comparison chart, is a great resource for you guys. So that link will actually take you to our Nebraska NTSS website, where there's a link to the screener comparison chart. It's actually in an Excel document right now. And so you can certainly download it, but we would encourage you to save that link because our UNL colleagues are often updating and adding information to that resource. But it's just a nice resource if you're looking at just trying to compare what your why is and really what you're looking for in a screener. Just a quick note on consent as well. So this is just a nice reminder that the federal requirement is that you must notify or provide passive consent, but states and districts may have other requirements based on the type of screening. So active consent might be required based on what screener you're using and what questions are on it. So always good to check into that and have those conversations as well. So we would encourage you now just to take some time to potentially pause the video, have some time to reflect. If you're with your team, have some discussions around these action items. So looking at the teaming structure, determining your why and really examining your data and what data you have accessible, what data that you need. Deciding what skills to measure and what screener might be that best fit, and using the screener comparison tool as a resource as well. So I am now going to turn it over to Mackenzie to move us into part 2 of intervene or screen, intervene, and everything in between.
Thanks, Jill. So now that we've talked a little bit about the purpose of a screener and selecting a screener, we're going to dive a little deeper and talk about some of those implementation logistics, setting up a timeline or a follow-up protocol, and then engaging stakeholders throughout the process. When thinking about consent type and what skills you want to screen for, Jill had talked about that with selecting a screener, and those really go hand in hand with some of those implementation logistics. So first and foremost, we want to have a plan before we start implementing anything. We want to talk about what our process is before we begin. And by going into this process with a plan, typically it will go smoother, and you'll also be able to use that data more effectively if you know what direction you might be going before you begin. Well, having these conversations, we want to talk about the process within our existing systems. Ideally, you'll have some multi-tiered systems in place already and some structures, and we don't want to create a whole new process on the side over here. We really want to embed it and integrate it with what we're already doing. Jill mentioned it before when talking about MTSS teams, but the people having these conversations would ideally be represented within the MTSS team. That way, as we're having conversations and we're planning things out, we're able to set up processes that support varying levels of need across our different tiers within our system. And going hand in hand with meeting different needs, that also You want to think about identifying how your screening data will inform your service delivery, thinking about your current data and what you have, and what will this new information provide, and how will you be using this information to help identify needs and then intervene to meet those unmet needs. And finally, just remembering that through this process, you're going to find unmet needs. You're going to come upon different situations where you might need to assess further or do some extra investigating to help collect information to intervene. Moving forward, we're going to talk about the projected capacity, serviceable base rate, and base rate. These will define each one of them and then talk about how they fit into making an effective plan to support your students. First is projected capacity. This is pretty much what it means is the number of students that you may need to support across tiers. This is a grounding number or a frame of reference or a big picture, and it's not something that you can manipulate. This number is something that's based on your population and the hard numbers. And so you'll see on the image here, we have an example of what it might look like. And so our example is a student population or a school of 400 students, and then how many students would be in each tier. That the percentages are based off of our framework workshops. So in tier 1, that core instruction, well, all students get core tier 1 instruction. 75 to 85% of those students ideally would have their needs met with that instruction, which in a school of 400 would be about 300 to 320 students. Like I mentioned earlier, this is really just a frame of reference or a grounding number. It does not take into consideration any specific needs for your school or your building. So this is really just something to help you conceptualize what those numbers might be. Ideally, if our systems are strong and they're supporting students where they're at, these numbers would meet where our serviceable base rate is. But sometimes that doesn't always happen. So on the next slide, we just have a blank image of the previous slide. You can pause the video and fill this out for your population. So on the bottom, you would put the total number of students you have, and then you would find out those specific numbers within those percentages and fill them in on the lines. So like I mentioned, in a perfect world, these numbers would match up with your school's ability to provide the equivalent services. But since projected capacity doesn't encompass any specific needs of your population, that's why we also need to find our serviceable base rate. This number is the number of students that you can realistically serve in your building. This takes into any contextual variables such as the number of interventions that you have to provide, the number of students you may need to support by your interventions, and also any time, material, or personnel that you have available to you. Some different questions that you might ask to find your serviceable base rate are: how many staff members are available to facilitate an intervention? Do you have a full-time counselor that can do small groups or that can lead some check-ins and check-outs? Do you have a secretary or some paraprofessionals that might be able to have their schedule changed so they could provide some intervention throughout their time in the day? There's a lot of different questions to ask. That is why we really want to hit home the thought that this needs to be a team process. If we're engaging in these conversations as a team, we have multiple different roles at the table, a lot of different perspectives, and that way, as we're asking these questions, we'll hopefully have the answers. And when we're engaging in this process, You might also start doing some resource mapping. So you might be identifying what supports you currently have in place, or maybe how you can reallocate some of those resources. So when you have that team at the table, they're really able to dive deep and think creatively for how they can provide services for their building's needs. One example for how you could map out your various interventions is through a simple chart like this. As you can see, you have different interventions listed, and then it goes through the number of staff that are trained for the intervention, how much time you're anticipating the intervention to take, or how many students you're anticipating you could serve within that intervention, where it will happen. So maybe it happens in the classroom or the office or the hallway, and then what resources you need to dedicate to that intervention. Again, this is an example. We encourage you to take this and change it up to adapt it to your school and your school's needs. It is a nice tool to help you visualize and plan out what those interventions might look like. But we also wanted to point out that we left some of those boxes blank because we want to acknowledge that while we can plan really well, we want to be making decisions and intervening based on our data. And so if you get your data back and you're not seeing a need for what you planned for, you might adapt some of the interventions you're providing to better meet those needs. When we are building a system, we want to build it with the people who the system is going to serve. You want to build that with them in mind. And so I mentioned before the contextual variables of different schools. You might have a school that has a lot of trauma or that went through a recent community crisis, such as flooding, or maybe mental health crisis, or a death of a well-known person. And so based on your building's needs will depend on how you serve them. When we think of MTSS, we want that to be a guideline or a structure for tiering your support, but it's not a prescription based on what supports you will provide in your building at each tier, because each school again has different needs for the students that they serve. So at the core, MTSS is driven by that decision-making process that uses high-quality data. So a piece of that data could be the screening data you collect, and the interventions on the screen here may be interventions you could provide at that tier. But if you're seeing a need in your building, you might change some of those services and what they look like. Moving on to base rate, this is the percentage or the proportion of students exhibiting unmet social, emotional, and behavioral needs. So when we think about screening data, you would think about what percentage of your students are flagging at risk or at high risk. And then you would use that number, and that would be your base rate. When we're thinking about base rate, this is for screening data, we're thinking about those social, emotional, and behavioral needs that aren't being met. A lot of times the students that are flagging in our screening data will also flag in our office referrals or our attendance data or in grades. So it's important that we take this information, but we also want to triangulate it with all the other data so we can kind of see the big picture of need in our building. Step 5 of thinking about screening success is talking about an implementation timeline. So when we think of our screener, we want to think about how many times are we going to do it, when are we going to do it, when are we going to look at the data. There's a lot of different logistical things to consider. So you want to create a timeline for your process, including how often you screen. If you screen twice a year, you can use that data to help evaluate your impact of your tier 1 services in your tier 1 focuses. Some schools do it 3 times a year. You want to consider if you're having the teachers fill it out, you want to give the teachers enough time to get to know the student before they fill the screener out. Talking about scheduling dates and meetings to share their results. We don't want to give a screener and then never talk to the teachers about the information that we gather. And so being mindful of filling the screener out, giving them that time, but then providing the time and space to have conversations with your staff about what you found when you collected that information. And then thinking about follow-up. So do your staff have a time to have those conversations? Do they have a time to ask those questions if they're having questions? And really just getting some dates on the calendar, because we know if we don't have things scheduled out, then it's pretty easy to forget about them or to do them loosely. But we really want to make sure we have dates on the calendar and we have a plan moving forward so we can roll it out and everyone will be on board and know what the plan is. And as you're engaging in this process, we want to consider our stakeholders. So here on this chart, we have school stakeholders and family stakeholders. I'll talk a little bit about before implementation, during and after, but also want to mention that we can't forget our students as stakeholders too, especially if we're providing a screener that does student response. So before implementation for school stakeholders, you want to inform your staff of the process you've created and provide some professional development. What do the staff need to know? You want to make sure you provide enough training for them so they have a general consensus and understanding for how to fill out the form. That way, each staff member is filling out for different students, but the data, if they have good information about how to complete the form, the data will look better if the understanding for how to do it is the same across all your staff. And they want to know what they're doing and why they're doing it. So providing some information around that. The same goes with families. You want to tell them about the screener, maybe give them the why you're doing it and talk about some of the benefits. You could give them the opportunity to view the screening tool. Not all parents or families are going to want to view it, but some of them will. And then give them time between notifying them of the screening process and actually implementing the screener. This will give the families time to talk and to read and gather that information, but then also give them time to give their active consent or opt out if they're wanting to do that. During implementation, so you have the screener, you're giving it to the people who will fill it out. What do you do during this time? Your school stakeholders, you really just want to provide some technical assistance. So giving them the timeline for how long they have to complete the screening information, when do you want their data by, answering any questions they have along the way. For your families, you want to remind them that you are now administering the screener and also answer any questions or provide support as needed. And then after implementation, you want to share results with your school stakeholders and any follow-up protocols. This doesn't necessarily mean you have to tell every teacher what students are getting, what intervention they're getting, but maybe talk to them about the specific students that impact them. You could also share school-wide that base rate data, how many students are at risk and how we're going to approach supporting them. And that might also mean beefing up your tier 1 support, which would impact all staff. And then for your families, having a protocol for how are you sharing results with families and what are the next steps? So if my student flags at risk, what will you do and how will you communicate that with me? You might need to follow up in writing and just provide some resources as needed. So when we're thinking about those 3 middle steps, 4, 5, and 6 of logistics, timeline, and stakeholders. The most important thing really is just to have some sort of plan. We know that if we don't have a plan, sometimes we forget steps or things don't move along as we would prefer. And if we do have a plan, hopefully things go a little more smooth, and then we can respond more appropriately and in a timely manner. Now we will ask you to pause the video and talk with your team about these different steps within your building. We encourage you to go back if you haven't and fill out that projected capacity form. Think about and have conversations with your serviceable base rate, and maybe get some dates on the calendar for your implementation timeline. And don't forget to talk about your stakeholders as well. And now we'll send it off to Emily to talk about the last few steps of screening success.
Thanks, Mackenzie. As we wrap up our third part of this series, we'll talk about administering the screener, analyzing and acting on data, and self-reflecting on the process. As a reminder, as we were getting into this, once you have completed the screener, you do have that ethical obligation to follow up on the data compiled in a way that is timely, meaningful, and defensible. On this slide, we have a graphic that breaks down the different categories that your data might fall into, depending on the base rate and serviceable base rate that you identified earlier in the section with Mackenzie. If your base rate is greater than or equal to your serviceable base rate, or in other words, when your student need is higher than the number of students that you can realistically serve, then you would look at increasing or refining your tier 1 supports. If your base rate is less than your serviceable base rate, but you have 1 or more classroom base rates that are greater than or equal to your serviceable base rate, meaning that there are some pockets of need, but overall your school is serving the needs of your students, you would then want to look at adding or increasing your classroom or grade level supports. And finally, if both your school and classroom base rates are less than or equal to your serviceable base rate, showing that you are meeting the needs of students and that those needs are spread evenly across grades and classrooms, then you can focus on your tier 2 and 3 intensified supports. And we'll show you some more examples of that a little bit later. An important note on using data, we want to make sure that you are using multiple sources of data and that your screening data aligns with what you already have access to, and that you are choosing and implementing interventions based on what the data is showing. So as you're doing your screening, go back to that slide that Jill had shown earlier with all of the different areas of data that you might already have access to, and make sure that you are using all of those as you're making your decisions. And in doing that, we need to make sure that we have decision rules in place for what to do with all that data that we collect. On the screen is a very generic example of what you might include in your decision rules. Remember that your decision rules are built off of your data of what is going on across your school or district. So like Mackenzie said, if your school or district has recently experienced a flood or some other crisis, your data is going to look different for the needs of your student. And so making sure your decision rules are reflecting that. And a helpful way to think about your decision rules is by asking yourselves a question. We think our core is working if most students are meeting X, Y, or Z. And that would be that they are in that low risk section. I'll also caution you that decision rules don't always catch all of our students with needs, and that they should always be used in addition with educator, student, peer, and parent nominations, and also any crisis situations. Any of these things could be an entry point into the problem-solving process. So if you have a student who generally does pretty good, but has hit a crisis or a significant change in their life, that might be a way that they need to enter this process. Or if peers are reporting concerns about other peers, they might enter that way too. So thinking about all of your data, all of the ways that these students can become identified, that they might be having some needs. We also included in here an example of tier 2 and tier 3 intervention tracking form. And you can use this to help determine where your base rate falls in comparison to your serviceable base rate. Now we're going to go into 3 case examples, and these have been adapted from the Missouri School-Wide Positive Behavior Support and Daniel Rector, who presented on this at our 2020 NeMTSS Summit. And these examples will hopefully give you a better understanding of how to make database decisions when addressing the needs in your building. So we will break down these 3 schools on the following slides. And for these, we'll be using the example that Mackenzie had shown earlier, where each school has 400 students. And so therefore their projected capacity is the same. And then for ease of understanding, we've also have their serviceable base rates to be the same. Although, as you know, each building will have a different serviceable base rate that is based on access to staff, time, and interventions. So school A here has a base rate that far exceeds their serviceable base rate. They currently have 125 students identified at tier 2 when they can only realistically serve 45. So we've listed some reflection questions here for your leadership and your problem solving team to reflect on, as well as some next steps that you might take. As shown on the earlier graphic, we would expect that they would look at increasing and refining their tier 1 practices, such as including an SEL curriculum, mental health promotion, looking at positive discipline practices, and examining and reteaching any school-wide expectations that they have. Leadership will also want to ensure that they are providing relevant professional development to all staff, and that their efforts are focused around the needs, the areas of need identified by their data. Here for school B, they have a base rate that is less than its serviceable base rate, so they are meeting most of the needs. However, there is a high level of need in the 5th grade and also in 2 individual classrooms. So in this case, they want to continue to refer individual students to tier 2 supports in the other classrooms as needed, while increasing those class-wide supports in those high flag grades, so across grade 5, and then in those classes that were flagged high as well. And in doing this, they can do things such as specific social skills teaching, and increased teaching, practicing, and feedback and following expectations. And then looking at additional support and resources for the teachers in those identified classes would also be beneficial. And finally, school C has the capacity to and is meeting the needs of all of its students, but this does not mean that their work is done. As their tier 1 supports are meeting the needs of majority of their students, they can focus on really providing those small groups and individual interventions for students needing those intensified supports. Here also, leadership and problem solving teams will want to ensure that they are not under or over identifying students for services, or are they over or under identifying students of a certain demographic, and they will work towards that continuous improvement. As our national PBIS consultant, Heather Robbins, likes to say, you can't intervene your way out of a poor or no core. We know that it is tempting to want to jump directly to those tier 2 and 3 interventions when you have lots of students with identified needs, but your time and efforts will have a greater impact if you put those towards refining your core. As you reflect on your screening and progress monitoring process, we have linked a document with some prompts to help guide the conversation. These can be accessed through the PDF that you got the QR code to at the beginning. You will want to know, is what you are doing effective, efficient, systemic, systematic, meaningful, and responsive? As Nebraska MTSS, we believe that if we follow a problem-solving model built with the essential elements in mind, then we can make decisions that will lead to positive student outcomes. And we have linked on this slide as well to our essential elements. If you do not know what those are or just need a refresher, you can go there and learn more about each of those. So throughout this presentation, we went through the 10 steps to ensure screening success. And if you haven't yet, we encourage you to go back through those action slides and talk through those with your team. And if after watching this video, you still have questions or are interested in further implementation, here are some other supports we provide on this slide in training and implementation support and in technical assistance. So please reach out to us with any questions and we can happy to set up a meeting or Zoom to talk through next steps. We also have a QR code on this slide for our SEBL Coffee Connect series. We began this series virtually in January 2021 and hold a session every month, offered at 2 different times live and are also recorded. So the QR code will take you to our YouTube channel, which has all of our previous recordings, where you can watch those and have access to several resources to help you support your SEBL implementation. Thanks for joining us today.